Okay, well, I am going to get started. Sorry that I couldn't be live at the regular time today, but I had a doctor's appointment, as I said in the announcement. Okay, so today we are going to be finishing Module 2 about paternalism and continuing our discussion from yesterday of the market for kidneys, or market for organs. I also should say that all of the exam grades are now posted, so they're up for you to look at. As I said, I split it into two different parts, the multiple choice section and the essay section. So I'll talk more about the exam results and everything tomorrow when we're doing the review for the next exam, which will be coming up. And again, I'll be posting that not long after the end of the review session, probably around 2 p.m. And you'll have, again, until the end of the coming Monday to do it. Okay, so starting with Becker and Elias. So today we're going to be looking at arguments in favor of the market for kidneys. Yesterday we looked at Satz, who argues that there are serious moral problems with having a legal market for kidneys. So I'm going to be looking at the alternative view here today. So there are a few points that Becker and Elias make along the way in their argument. So they start by just setting up the situation for us, and the situation is a little bit grim. Wait times for kidney transplants are very long. It takes years on average, and many people in fact die waiting for their kidney transplant. And really the only way that we can reduce wait times, apart from preventative measures to prevent people from needing kidney transplants in the first place, is we need a greater supply of kidneys. And to get a greater supply most effectively, the authors say we should allow some sort of compensation for donors. We want to create a system where donors are incentivized to, where people are incentivized to be donors, beyond just altruism, is the idea. There's also this problem in altruistic donations of matching, where even if you have a kidney that you would be willing to give up for someone else, matching your kidney to the tissue and blood types that they need can often be difficult, and this restrains a lot of kidney donations that might otherwise go through. Now Becker and Elias point out that barter is possible in this area, so if you can find someone else who's in a similar situation and they match the tissue type that the person you're trying to donate to needs, and you match the tissue type of the person they're trying to donate to needs, then you can make some sort of exchange, and this happens to some extent, but as they point out, although barter is possible, it's a very difficult form of exchange. So one of the reasons that money was invented in the first place is that barter on this of this sort is very difficult, and so having a medium of exchange, having a way that you can not have to find someone else with the exact situation that would meet up with your needs, makes it a lot easier to engage in exchange of even altruistic donations. So the authors say that there are two main criticisms of the market for organs. Now, of course, we saw yesterday that we could split this up into a variety of different criticisms, but the two that they want to look at here, one is that it wouldn't be effective, that we wouldn't actually see a significant increase in the supply of kidneys, and two, that it would be repugnant, that it would be preying on the desperate poor, that it would be the sale of human body parts, which some people find intrinsically repugnant. So in response to the claim that the market for kidneys would not be effective. Becker and Elias point out that this argument isn't consistent with the data that we have from other markets that are relevantly similar. So, for example, they bring up the market for surrogate mothers. Surrogate mothers are permitted to be paid, and like kidney donors, they have to, in a sense, give up part of their body. In the case of surrogate mothers, it's for a period of time, whereas in the case of kidney transplants, of course, it's forever. But there are similar possibilities for negative health side effects and such things. And they find that, in fact, we do have a good supply of surrogate mothers. And if we didn't, of course, the market could respond by raising the compensation that potential surrogate mothers could receive. So that's one sort of case that's clearly very similar to the kidney case. They also bring up the case of a voluntary military. So a lot of people thought before the end of the draft that the problem with the voluntary military is that you couldn't get enough people to risk their lives and be a part of the military if it was on a completely voluntary basis, right? That the draft is all that allowed us to have a reasonably costed military. But in fact, we found out, of course, that there are a large number of people who are willing to potentially sacrifice their lives or parts of their body in exchange for just the compensation that is given by the military today, which is not particularly outlandish as far as the cost per soldier. So that's their argument against the claim that it wouldn't be effective in increasing the supply, that there are other cases which would suggest that it would. So the second argument, the argument that it's repugnant in some way, the argument that the authors want to make in response is that we need to compare the moral problems with a market for kidneys with the moral problems of a policy which results in thousands of people dying every year because they couldn't get a kidney transplant, and thousands more who have their lives put on hold or stulted or made much worse by needing to be on dialysis when otherwise they could have had a kidney transplant. So when we're considering then the morality, the moral issues involved in a market for kidneys, they say, look, you also need to consider the moral concern of not having a market for kidneys, of continuing with a very limited supply of kidneys relative to the demand for kidney transplants. So they mentioned one possible regulation that they would support to combat some problems of ill-informed or rash donors, and that's that we have some sort of waiting period set up. They suggest 3 months, and this is for donors, just to make sure that they have time to discuss with, sorry, my Skype is, okay, just so that they have time to discuss with family members, with counselors, to make sure that they are making the right decision for them, for their particular circumstance. And finally, they close with this point about altruistic giving. So there was a worry, you remember yesterday when we talked about SATs, there was a worry that altruistic donation of kidneys would go down in a world where kidney sales were permitted, because family members would feel that it's reasonable for them to acquire a kidney in another way. Or, you know, there could also be effects of just making something into a market commodity can sometimes decrease people's altruistic feelings about giving there. But Becker and Elias point out that although donation of kidneys in an altruistically would probably decrease as a result of having a market for kidneys, altruistic giving of money in order to pay for a kidney transplant would likely increase. And the reason to think that is that because the situation has changed in this way and it's become an issue more about money rather than about donating an organ, we can expect that people's altruism will be shifted rather than eliminated. Okay, so that's Becker and Elias in brief. Now let me move on to the short video that I asked you to watch from James Stacey Taylor. So he wants to argue that kidneys should be allowed to be sold like any other commodity. So he's taking the position that Sats argued against yesterday. And he doesn't make a lot of arguments in this particular video because it's quite short. And he weaves in a story which I think is helpful in understanding really the stakes that are involved here. But he points out in a kidney transplant case right now, as it is currently, everyone involved gets paid. The doctors get paid, the nurses get paid, the people providing drugs get paid, and so on. Everyone gets paid except the person who's donating their kidney, who's giving up the kidney that makes the entire transplant possible. And this doesn't seem quite fair. Why should they be the only one who has to be a pure altruist and give something up without anything in exchange? Taylor says. So that seems like an argument that can strike against a lot of the questions about the moral problems, but not all of them. So many of the problems that Sats brought up are ones not so much about the morality of selling human parts per se, but rather about the issues in whether the person selling, the person donating the kidney is fully understanding the sort of situation they're getting into, or if they're getting into it in a fully voluntary way. And Taylor goes on to echo a lot of what Becker and Elias were saying, in that banning kidney sales worsens the lives of both potential donors, those who would otherwise be compensated, and potential recipients who otherwise may not get a kidney at all. So he thinks on the basis of these sort of reasons we have a strong moral case to permit a market for kidneys. So that's all that I have on these two. For those of you watching live, if you have any questions, I would be happy to answer them. And I will wait a couple minutes to give people a chance to ask any questions. Okay. Yeah, so there's a question about when the next exam will be due. It's not going to be due tomorrow night. Rather, I'll be posting it tomorrow night, or tomorrow afternoon, and it will be due on Monday, on the coming Monday, just as exam 1 was due on the coming Monday, after I posted it. Okay, it looks like that's all the questions for today. So tomorrow I'll be doing a review of Module 2. I'm also going to be talking about how the Module 1 exam went, where people could improve generally, and yeah, so I hope to see you tomorrow. It'll be at the regular time tomorrow at 1 p.m. Okay, thanks.